Does palliative surgery save money on pancreatic cancer treatments? When facing pancreatic cancer, many wonder if palliative surgery can help save money on treatment costs. Palliative surgery is mainly aimed at easing symptoms and improving quality of life, not curing the disease. It often involves procedures like biliary bypass or gastric bypass to relieving blockages caused by the tumor. These surgeries can reduce hospital visits for complications like biliary or gastric outlet obstructions, which might lower some immediate healthcare costs. However, pancreatic cancer treatment overall is very expensive. Costs often exceed $65,000 from diagnosis to death, especially in advanced stages. This is because treatments like chemotherapy, targeted therapies, and supportive care add up quickly. Chemotherapy regimens such as FOLFIRINOX or gemcitabine are common and can be costly because they requiring ongoing outpatient visits and supportive medications. Studies show that while palliative surgery may cut costs related to repeated procedures or hospital stays for obstructions, it involves upfront surgical expenses and potential complications after surgery. These complications can sometimes lead to additional treatments and hospital stays, which increase costs. On the other hand, less invasive options like endoscopic stenting are often less expensive initially and can quickly relieving symptoms. But they might need to be repeated over time, which adds to long-term costs. Some research suggests that in certain cases, surgical palliation might be more cost-effective than repeated endoscopic procedures when considering long-term quality of life and symptom relief. Still, this depends on the patient's overall health, expected survival, and specific clinical situation. It is also important to remember that patients receiving palliative care, whether surgery or chemotherapy, often spend a lot of time engaged with healthcare services, which adds indirect costs like travel and time off work. In summary, palliative surgery can help reduce some symptom-related costs in pancreatic cancer, but does not necessarily lower overall treatment expenses. The disease's complexity means that most patients requiring multiple types of treatment, which can be costly regardless of whether surgery is performed. The decision to pursue palliative surgery should always be personalized, considering the patient's health, goals, and financial situation. Consulting healthcare professionals is essential to develop a plan that balances symptom relief, quality of life, and resource use. Overall, current medical understanding emphasizes that palliative surgery is mainly about easing symptoms and improving comfort, not about saving money. Any potential economic benefits are secondary and depend heavily on individual circumstances.